Hello everyone, I'm Priyanka Paul, clinical psychologist associated with Salt Lake Mindset, and today I'm going to try to bust a few myths related to depression in children and adolescents. Among many myths that prevails in the society, the most common one is children do not suffer from depression, and in adolescents, having mood swings, getting angry and irritated easily is normal because of the biological processes. Well, the fact is, in India, 1.6% of children aged between 4 to 11 years suffer from depression. And in general, 2% of adolescents aged between 12 to 17 years are diagnosed with depression. Well, you can see research reports that depression in children and adolescents is pretty much prevalent in the society. Another myth that runs is boys do not suffer from depression. Well, the ratio of male is to female is 1 is to 2, which indicates that boys are also not immune from this mood disorder. Another myth that I would like to talk about is people believe that if children and adolescents suffer from depression, they do not need any treatment. Take the child out for a movie, go for a holiday, have a picnic, have a good chit chat, and the child will be just fine. The fact is, depression has a lot of neurobiological underpinnings. There is a lot of imbalance in the dopamine and the monoamine neurotransmitters. Speaking from a psychological viewpoint, if we follow Beck's theory of depression, he has suggested of a cognitive triad, a negative cognitive triad. That is, a person starts having negative automatic thoughts, negative thoughts about the self, about the world, and the people around. Overcoming such difficulties needs treatment, that is both pharmacotherapy and psychotherapy. But yes, these treatments are not for the rest of the life. These are time-bound treatments. Once a person progresses, the treatment stops. It's gradually ended. So it's not a lifetime saga that's going to continue. Neither depression nor the treatment. And the last myth that I would like to talk about is I've seen people blame themselves, especially parents and family members, for their child's deteriorating mental health. Well, especially in case of depression, depression does not occur because of one person or one incident per se. If we follow the biopsychosocial model, there are a plethora of factors which gives rise to this state, to this condition, where a person starts feeling very low, very sad, cries most of the time, especially in adolescents and children. They get angry and irritated very easily. They refuse to go to school, they don't want to eat, they don't want to socialize, they don't want to talk to anyone. They appear very discouraged. They suddenly lack concentration, they suddenly don't want to study, don't want to attend classes. This does not happen overnight. And this does not happen for one person. That's the biggest myth. So the next time you come across a child or an adolescent who appears gloomy, who appears sad, who appears really distracted, really troubled, ask yourself, is there something that the child wants to say which he or she is not being able to understand? Because children cannot voice their thoughts out the way adults do. They need listeners who can also help them speak. Try to be a listener to them, an empathetic one, of course. Thank you.